Hi, I'm Dr. Erin Ducat with Ducat Chiropractic and Sports Medicine. Today I just want to teach you about a concept called regional interdependence. This is a term that we use in medicine to describe when the movement of one body part affects the movement of another. For instance, let's say you've got really tight shoulders, upper back, right? You've been sitting on the computer a lot, you're stuck like this. You may not come into my office with shoulder or upper back pain. You may come in with neck pain or hip pain or low back pain. This is because the movement or lack thereof of your upper back is affecting the way that those other body parts have to do their job, putting extra pressure, extra strain, and eventually the straw breaks the camel's back and you start having pain. That's when you come to my office. So part of my job as a chiropractor is to figure out, of course, first of all, make sure that your condition is actually something musculoskeletal, not something internal that needs referral over to a medical doctor. And secondly, to figure out what body part or what structure is actually at the root of the problem. I know many of my patients will say come in with ankle pain, knee pain. They think I'm crazy at first because I ask them to show me, hey, how does your neck move? How does your shoulder move? Raise your arms up overhead. They're like, lady, the problem's not in my shoulder. The problem's not in my neck. The problem's in my ankle. Fix my ankle. Well, I'm screening them for this regional interdependence. There's a book called Anatomy Trains. It was actually written by a massage therapist in Rolfer. It's a great text, probably a little complicated for the layperson, but if you're into these type of things, working out, know your muscle anatomy, might be interesting read. You can get it on Amazon. That's what the book looks like. And in this book, he goes through and he describes all of these different fascial and muscular connections or chains that you have in the human body. Like for instance, this is the back, front, and ipsilateral functional lines. He's got all these technical terms for these body parts in trains, but you can see how it connects the shoulder into the low back, into the hip, and then into the thigh. The same goes for this front view here. You can see the chest connecting to the abdominals and into the pelvis and into the thighs. So something that would be happening up here could affect how you feel down here. I had a couple of cases actually here in the last week that were interesting when it came to regional interdependence. One was with a golfer. She was having some low back pain, especially when she rotated to the right in her backswing. As we went through the evaluation, we realized that her low back was actually moving fairly well in that way. She could rotate really well, she could extend really well in her low back. She couldn't flex forward too well, but that really didn't pertain to the movement when she was playing golf. But as she went back into her backswing, we noticed that the shoulder and upper back and neck, that was the section was stuck. It was literally stuck together, kind of like this, and of course I'm overemphasizing for the video, so that when she rotated back, this area wouldn't fully open like this, so then extra strain was put in her low back. We did a couple of adjustments, a couple of stretches, gave her exercise that she can use to reinforce that movement at home, and suddenly she's rotating the right. She's like, oh my gosh, it doesn't hurt. So although her pain was in her low back, her diagnosis technically was in her low back, her problem was up here in the upper quadrant. So that's the area we want to treat, that's the area we want to address so she can have some long-term results. I had another patient who her presenting complaint was hip pain, leg pain, especially with walking and getting up from a chair. And we found out that although her hip was very tight, her upper back and shoulders and neck were even tighter. So basically, her low back was getting the brunt of it, her hip was getting the brunt of it because she was stuck forward like this. So when she's walking around, you can imagine the amount of strain being put on her low back and into her hip area, or getting out of a chair if you couldn't fully straighten up through here. So again, we did some very targeted adjustments, stretches, exercises for the upper body, and suddenly she's walking with less pain and getting out of a chair with less pain. So the next time you're at the chiropractor, or if you come here and I start looking at your neck, shoulders, ankles, an area of your body that's not necessarily painful, don't worry, I'm not crazy. I'm just checking you for regional interdependence. And if you do see a chiropractor that doesn't take this approach, or a physical therapist or medical doctor for that matter, please seek out someone who does or ask them about it, because that way you can get better faster and find out what the real root of your problem really is. If you need more information about my practice here in Bloomingdale, check out our website. It's at ducatchiropractic.com. So it's DUCAT chiropractic.com. Thanks.